There's several ways to approach all this. One is to go the snake oil salesman and say how much is too much for a good night's sleep. And that, as much as that sounds corny, cliche, and a bit American, it's actually a fair call, because that is the way you've got to weigh it up. So it's not inexpensive, but surprisingly, it can be as cheap as, if you go onto some sort of care plan, you can get it, $50 to $100 a week would pretty much cover the cost of the Rolls-Royce splint therapy. It'd take you about 6 months to get there, but it's still very affordable to even have the best. But there are some less expensive options that we look at, because not everyone can afford the best, but certainly if you can, it's worth it. You really do get what you pay for. Now, as far as cost of CPAP and a really good splint, they're comparable in cost. Why we're reluctant sometimes to talk about cost this directly is because you're not going to Coles and buying something off the shelf. It's a customised or bespoke sort of appliance that's custom made for you. So there's a lot of work up to get to the point before you get to a splint, because obviously it's a dental treatment of a medical condition. So both disciplines have to be respected. So essentially you can't just expect to go and get a splint. You cannot put a mandibular advancement splint on rotten teeth. It's that simple. So you have to have a full dental check. You have to have appropriate radiography. You have to be told all the possible side effects, long-term and short-term. You have to be told what your realistic expectation of an outcome is. So when we say to you, you know what, it's about $2,000 to have this treatment, you're not actually buying something that costs $2,000. You're buying a whole treatment that costs about $2,000. The other good thing, of course, is that if you're health funded, there are rebates, etc., for health funds for dental treatment, which is really good. So that makes it also a little bit more affordable. The cost of PAP, it's not really my area, but it's like be close to you, keep your friends close and your enemies closer. So I can tell you that cost-wise it's about the same, but you have consumables in PAP. So you do have to change the mask regularly, and sometimes the hoses and things like that. So it is a more consumable process. The ongoing cost for splint therapy is review. So we review the patients dentally and of course checking for their treatment outcomes as well. So there is an ongoing cost with both of them, and they're probably quite comparable.